So my name is Alex Rampotas. I'm based at UCL Cancer Institute in London, and I'm very excited to present to you this novel therapy we co-developed along with Dr. Martin Pule and Claire Roddy, and it's a novel CAR T-cell therapy about a new target, mutated Calreticulin for MPNs, and specifically myelofibrosis. I have nothing to disclose. So myelofibrosis has a dire prognosis. It's one of these cancers where we still don't have effective treatments. Actually, the only curative treatment is an allogeneic stem cell transplant, but it's only available for around 10 to 20% of patients. And even in that setting, it is associated with up to 25% treatment-related mortality. So a quarter of patients would die just from the toxicity of this treatment. CAR T cells, because they act selectively, they can potentially eliminate the malignant clone and allow the normal stem cells to recover, restoring normal hematopoiesis. So I think it's a very exciting approach. And if I could put all this in a very graphic way, so patients with MPNs usually they start with essential thrombocythemia, which is a more benign disease. They progress to myelofibrosis and eventually to acute myeloid leukemia, which is very hard to treat. So if you imagine this strain, I mean, there are some treatments that they try to derail this strain off the tracks, but actually none of these have been disease-modifying. And as we discussed, allogeneic transplant is the only treatment, but very high toxicity. So what we really need is some very good treatment. So in terms of the research we have done, so with CAR T-cell therapies, the first step is to identify a binder that selectively binds to your target, and then to incorporate that into a CAR construct. Then we test our CAR T cells in a dish against cells just to see that these CAR T cells will kill these malignant cells that we want. And then we stress this CAR T cell, we re-stimulate it, we make it work harder and harder just to see how fit they are, how much they can sustain repeated stimulations with the cancer. And then we test for efficacy against patient samples, and then we move to in vivo models in mice. And the results so far have been fantastic. We have shown excellent in vitro efficacy. And as you can see here with this specific cell line that carry the mutation, when we inject that into mice, these mice will die very quickly. This cell line will cause very aggressive leukemia carrying the Calreticulin mutation. But if we treat these mice with our CAR, this will be able to control the cell line growth, and these CAR T cells will be able to expand in vivo environment. But I think the most fascinating result is when we culture our CAR T cell with stem cells from patients with myelofibrosis. And the myelofibrosis stem cell disease, that's where the cancer arises from. We have seen 60 to 70% elimination of these stem cells. And it's important to highlight that not 100% of the patient's stem cells will be malignant. So this likely represents elimination of the malignant cells while not killing the remaining normal stem cells. And we used a JAK2 mutated myelofibrosis as negative control, and our CAR T does not affect the stem cells. And also a negative control CAR T against CD19 also didn't show any killing as expected. So this is fascinating result because that shows that our CAR T will identify and eliminate malignant myelofibrosis stem cells carrying the Calreticulin mutation. So in conclusion, the CAR T cell can selectively target mutated Calreticulin disease on preclinical studies. This selective specific nature of this therapy means that potentially it could induce long-lasting remissions without significant toxicity. We are actually working already to improve this product, and there is ongoing development to make it work even better. And hopefully we'll be able to start a phase 1 first-in-human trial where all of the more complex answers about toxicity and efficacy can be answered. So I'd like to thank you, and I'm happy to take any questions.